Hi, Joe. Thanks for getting back to me. Oops. Do you know whether Connie's going to be able to be here for that navigation center and make a presentation?
I don't know.
Okay.
He was going to have one of her consultants do the presentation.
All right. We'll see if it happens. What?
Check in with Laura.
Okay.
Laura.
All right. Hi, Debbie. I noticed on the minutes that they didn't attributed something on page 7 to Debbie Hartman, and it was you that made the comment. Did you notice that?
I did notice that, and Debbie Hartman is actually a good friend of mine. She's my exact same age.
Oh, okay.
I went to high school with her. So.
Oh, really?
But she wasn't there.
No, she wasn't even at the meeting. No. So
Nope.
So that'll be a simple thing to change. Hello, Laura Montagna.
Hello, Timothy Doty.
How you doing today?
I'm great.
You're looking cheerful. How are you? Yeah, there we go. I gotta move this back so I'm not quite so big. So I should probably talk to you, Laura, about who to vote for.
You can definitely do that, I'll tell you.
I just have to look at the signs on your yard.
Definitely done a lot of research and interviewing with True North Organizing.
Oh, really?
Yeah, they've done interviews. We've done, I should say. I keep saying they, and they're like, you're part of us.
Yeah. Yeah, I know several people a part of it. You having a good time with it?
Yeah, I met some great people. Tony Gerard's awesome, and Ron and Rabbi Bob. Yeah.
I've never met Rabbi Bob. I've heard about him. That's cool.
He's a hoot.
Yeah, hoot. Oh, good.
Hoot and a half. Kind of like you.
Okay, let me see if I'm ready. Hello, Paul.
Hi, everybody.
You have a good time at the Board of Soups yesterday?
Oh, it was a blast.
I'm sure.
That was a nice presentation.
Thanks.
I did send you an email asking for your PowerPoint.
Okay. I'm really behind on my emails. Sorry, Laura.
It's okay.
I'll do that. I think we may have sent it to the board already. I don't know. Joe, did we send that to everybody yet?
I don't think so, no.
No, I don't think so.
I haven't seen it. Let's go ahead and do it.
Dig it up.
I missed that. What was that you were talking about sending?
The PowerPoint from yesterday's presentation.
Oh, okay.
Hello, Emmy. Do you know whether Connie is going to be with us, Emmy?
I don't know for
Okay.
sure.
Well, I was talking with Joe that the presentation on the navigation center, our memory is that Connie was going to bring someone to make that presentation, and I'm not sure whether that's actually happening.
Oh, did she confirm that?
No, not with me.
Okay, so
We'll find out.
I'm thinking that it probably isn't confirmed.
Laurel, do you know about a presentation on the navigation center? Connie said she was going to try to set that up, but I'm not sure that it actually happened. Do you know?
I've been working closely with the contractor, Hannah, and I am pretty darn sure that the person who's helping us with some initial work, and I'm pretty darn sure that she was not in this loop. So no, she is not here to present on that.
Okay, thanks, Lauren. My clock says it's 12:17. Let me just see. I see 6 board members. I may have got that count wrong. What's our total number now, Joe? Do we have 11 on the board?
We have 13.
We have
That's what I
12.
thought. We have 12. Okay,
Allison
so-
is trying to log in right now. I need to resend her the link. She's having a hard time.
okay, so if we have 6 out of 12, we have 50%. That's not quite quorum yet, but I
We
think,
need,
it would-
we need 7 for a
yeah, we
quorum.
need 7, so.
Let me send her the link.
Hey, Tim, I see a Tracy Cooper and a Tracy Connor as absent on those minutes from last time. Is that right? Do we have a Tracy Cooper and a Tracy Connor? I know Tracy Connor.
I don't know Tracy Cooper. Tracy Connor's not been with us and probably will be officially
Mhm.
resigning. She can't, but I don't know who Tracy Cooper is. Does anybody? So when we get to the minutes, we'll bring that up and see if we need to amend them for that.
Board's been growing so fast, I thought I might have missed somebody.
Yeah, no, we actually are going to be interviewing 3 more people this next week. And so,
Wow.
yeah, we're excited about that. So,
Can you say who they are, Tim, or will you?
yes, I'm having trouble. Gardner Carlson is a new man from the area. He used to work for, he's a psych tech who worked for Napa Hospital. And Vernon Price, who's been on our board, is coming back. And then a new man named Oscar, who I don't know at all. So next week we should be interviewing them.
Oscar Magolian.
That's it. Thank you. You know him then, Laura.
Yes, I do.
One of the people that you dragged in to join us.
I don't drag. I merely invite with enthusiasm.
There you go. I know, Laura. You have a very gentle, warm, and loving touch. So.
Can you see
All right, everybody. There comes Allison. I see we can get started. Maybe a couple other board members will be with us. Hi, Allison. Glad you got connected with us. You give us a quorum now, Allison. Way to go.
Thank you.
All right, I want to call our meeting to order. Welcome, everybody. This is our monthly meeting of the Behavioral Health Board, and we are the advisory board to the Board of Supervisors for the county, and we meet this on the 4th Thursday at every month. I want to say this is a public meeting and everyone is invited to attend. We provide time for public comments, and I will say more when we come to that time, but please note that this meeting is being recorded. And if that is a difficulty for you when it comes time to share, let us know. Perhaps we can mute it or we can talk with you offline so you can make your comments available to us. All right, I'm sorry, I got lost. The minutes, if you're new, the agenda can be found by Googling Humboldt County Behavioral Health Board, and then you will find such information within a list of committees. Do want to remind everybody to mute if you're not talking at that time, because who knows what dogs may be in the background. Okay, so we start the meeting with a roll call of the board members, and then we go with staff and we invite the public to say hello and tell us that you're with us. So also we like to give everybody an opportunity to provide their own personal pronouns, how they want to be addressed. So we'll make that possible. So Joe, would you get us started with the roll call?
Sure. Alyssa Norman. Laura Montagna,
here.
Steve Madrone. Tim Ash.
Here.
Tim Doty,
Here.
Tracy Connor. Madison Flynn. Allison Tans,
Here, she, her.
Debbie Hartridge,
Here, she, her.
Colleen Broderick. Isabella Wotherspoon,
Present.
Danette Kellerman.
Just me, Danette Kellerman.
So we have 7 members. We have a quorum.
Thank you. Go ahead with staff, and it's kind of random sometimes, but maybe we'll start with Emmy, and then all staff members, please introduce yourself and maybe tell us what role you have, what job you have.
Hi, good afternoon. Emmy Botzler Rogers. I'm the Behavioral Health Director here in the county.
Hi, everybody. I'm Paul Bignacki, he, him. I'm one of the deputy directors over crisis services and forensics and performance management.
Hi, my name is Jack Brazil. I'm a deputy director for behavioral health, and I am over a lot of our adult services.
I'm Jeremy Nilsson. I'm also deputy director for behavioral health over children's services, he and him. Thank you.
Hi, I'm Sharon Wolf, legislative analyst for DHHS, she and her. Good to see everybody.
Thanks, Sharon.
Hi, I'm Laurel Johnson. I'm an analyst in DHHS administration, she and her.
Hi, everyone. Sonia Levy Boyd. I use she, her pronouns, and I supervise the Humboldt County Transition Need Youth Collaboration and the peer coaches at the TA division.
Thank you, Sonia. All
Hi,
right, go ahead.
my name is Danette Kellerman. I'm a social worker for Humboldt Conflict Council, and that's it.
And a board member. That's all right.
And a board member.
Yeah. So thank you, everyone. It looks like board and staff have let us know that you're here. We want to invite members of the public to introduce yourself. You don't have to give us your name if you don't want to, but we'd like to hear it if you'd like to share it with us. So.
I guess I can go. So yeah, I also set something in the chat, but I'll bring it up later during public comments. But my name is Martini Vijay, and I'm currently an intern with Cal BHBC. And I'm just here to sort of see how this runs.
Thanks. Thank you. Glad to have you.
Hi, my name is Katie Wilson, and I'm a local psychiatrist.
Glad to have you with us. Anyone else would like to introduce themselves to us? When I noticed that Colleen, you're with us now, right?
Yes, I was unable to get in by computer, so I'm on my phone.
All right, glad you're here with us. An opportunity for anyone else from the public who would like to introduce yourself to us. Then, all right, then we'll go ahead through the order of our agenda. And want to ask, first of all, are there adjustments? Do we need to move some things around in the agenda? Anyone? Okay, let me just say this about the agenda. We have on there a presentation called the Navigation Center, and it looks like that is not going to be happening today. We didn't get our ducks lined up or whatever the right process for that to come and make a presentation at this time. So then this is an opportunity for public comment. Want to invite everyone to share at this time. And we ask you to limit yourself to 3 minutes and to try to focus on things that the behavioral health department or branch or the board might be working on or under our purview. So 3 minutes, come and introduce yourself and share with us your comment.
This would be a good time for you to present your information.
Oh yeah, okay, I'll go ahead. So I sent a link in the chat, and it's just calbhbc.org, but if you click on that link, you can go ahead and see different training opportunities that we offer and resources to you know, if you want these meetings to run a certain way, or if you want to get certain input. Yeah, my supervisor is very willing to help out and provide any resources that the state could offer financially and educationally. So yeah.
you think that would ever be a good time to have a presentation? Because I know your organization is important and many of us go to your site to get such ideas or training. Would that be helpful to us for to spend 10 minutes for her to come and tell us what you're all about? Because we paid our dues and not everybody, particularly since we have a lot of new people, don't know what you do. What do you think about that idea?
I don't have a formal presentation prepared now, but I guess I could just talk a little bit about what we do. So you could go ahead and like click on the link now, and we have a lot of resources.
I want to jump in and say I'm wondering if we can do this at another time, where we can give you all the time and you can tell us all about your work. Okay.
Oh, okay. Yes, of course.
We'd love to have you. I think it would be helpful to the whole board.
Okay. Yeah, absolutely.
All right. Thank you. Any other public comments? Well,
Yes.
there'll be, yes.
This is Sonia with HC Tasty and the Tate Division, and maybe it's more questions, but wondering where the process is for Humboldt on the Care Court SB 1338, and if that's something that's being discussed. I'm not sure of the implementation timeline, but wondering if that could maybe be a future topic on the BHB, or maybe that's something that Emmy would speak to at some point. But just wondering what the process is for Humboldt County in that, and maybe there's an opportunity, if it is going to be an agenda item, I can invite some of our youth advocacy board come speak and provide the TAE perspective on that.
That's great. It is important. And I've been following it and urge people to do that. Emmy, when do you think it might be worthwhile for some presentation that would be helpful to the board and the public?
Wait, on which topic?
The Care Court that's just coming down.
I mean, I don't know. I'm sorry not to put you on the spot, Nancy, but maybe she could help with that because she's really tracking it. It did just recently pass the Senate. But in terms of, I feel like there's ongoing work being done. So I don't know if I have like a full picture of what it's going to look like. It still is very much in process.
So maybe later. Nancy, you have any thoughts on when a good time?
Sure. This is Nancy Stark. I'm the Legislative and Policy Manager for DHHS. I apologize. My video isn't functioning properly. So yes, the Board of Supervisors has already taken a position on care courts. Care Court, the bill, SB 1338, was approved by the State Senate yesterday and now moves over to the Assembly. I'm certainly happy to provide more information to your board at any time, including the board's ad hoc legislative committee, and we could certainly agendize it for next month if you'd like.
Well, next month, Kathy Rigby is coming for a public meeting about the MHSA. So maybe we can pencil in and talk about July. Maybe we'll have more information to present. We can talk at the executive committee, because personally, I think it's a really big and important thing to talk about. But sure, what do you think about just thinking of July, Nancy?
Certainly, that's at your board's discretion, and I'm happy to come at any time.
All right, we'll pencil that in, and at the executive committee, we do that. Tim Ash.
Yeah, I just have a quick question for you, Nancy. I haven't looked at that bill, the specifics. Does that include resources?
Not for at this time. There are no resources for county behavioral health in the proposal. There is some talk of dollar figures for the court system, but not for county behavioral health. It would be expected to be implemented within existing resources and staff.
Thank you. That's a big issue. I see a hand from Katie. You have a comment about the Care Court.
I do. Just a couple things I can update people on regarding the Care Court, because I read through the whole thing and then I testified at the state Senate hearing online, which was a really neato. And so I've also attended a couple webinars specifically run by the state about Care Courts, and one in particular, NAMI California set up, and it was hosted by a NAMI California person. And then there was a person from the state, and I apologize apologize. I don't have the notes in front of me. I can say that what I would really love if other people share this opinion is that we would advocate that the state provide resources and share the care across counties. I specifically asked that question to the state person who's involved with implementing, writing the specifics of the plan. And she said no, that currently the state is not considering sharing care. That's my phrase that I'm kind of getting behind at this point, is like sharing care across counties, because to me, otherwise the whole thing is going to be discriminating against people that live in rural counties that don't have the same resources. For example, board and cares. I mean, to me, this is really going to be important, is board and care, like supervised staffed housing, and including being able to monitor medication adherence.
So Katie, I'm going to jump in. It's not maybe a good time to talk about it in detail, but maybe another word or two. You've been looking at it and you're in favor. Is that fair to say?
Well, I'm in favor of the idea, but I really think that it'd be good if we could advocate that the state should be providing treatment resources, especially because they have this huge surplus now. So anyway, I wasn't trying to make a position. I was just trying to add, well, I guess I was, but mostly just advocating that the state provide the actual treatment resources, including board and care type things, and that they share care across counties so that sister counties would be able to, basically maximize services by kind of, if each county in a region has different specialty services available, then it would make sense to have people be able to go back and forth, and then people would have equal access.
Right.
So that's all I wanted to say.
Thank you. Like we put the AOT as a regular item on the agenda because it's an important thing. We, at the executive committee, we can talk about to have this as an ongoing thing for us to examine and to talk and to share. Use it. Sonia, I don't know if you expected to get that response, but it is important, and we'll keep working on it, okay?
Yeah, thank you so much. I think I'll just try to track, or maybe because someone let me know if it's going to be on the July agenda. And then I can work with my staff and the Youth Advocacy Board to try to attend, because I know they feel very passionately about it and are doing some work around it as well. And I would love for them to have the opportunity to share the youth perspective with this group.
All right, thank you. We'll move on to any other public comments at this time.
Yeah.
Debbie?
Hi, Tim. This might be a time for me to mention something that NAMI is currently working on and planning.
Debbie, I'm going to jump in here because we have, for the board members, we have a time for our own communications.
Okay, well, I'll wait for that.
Yeah, so that this is the time for the public in general to share. And I really want to hear what you have to say, but
thank you, Tim. Sure.
Yeah. Okay.
I just wanted to confirm if Merdini Vijay, are you done with what you wanted to say today?
Yeah, pretty much for the most part. Yeah, we just have resources on our website to help with training and advocacy, member recruitment, like board organization, things like that. So yeah, so just feel free to check out our website. We have a lot of resources on there, and if you click on our newsletter, you can see upcoming trainings. We actually just got done with our round of trainings, but we always have more. So yeah.
Could there's probably a few people I didn't hear you say before what the acronym is, for those that may not know it.
Yeah, it's the California Association for Local and Behavioral Health Boards and Commissions. That's what it stands for. So we pretty much oversee like all 59 local behavioral health boards across the state. So yeah.
So the website basically provides a lot of different kind of diverse support for local behavioral health boards.
Absolutely, yeah. And how you can have your voice heard. And since we are represented in the state, we also want to support a lot of the communities, especially the rural ones. I know someone was mentioning earlier, a lot of the rural communities don't necessarily get that support as seen by some of these bills that are getting passed. So we also want to help bridge that gap.
Great, thanks.
Thank you. And you want to notice that Steve Madrone has joined us. Glad to have you with us, Steve. So Joe, make sure you put him on roll call as being present.
Apologies for my tardiness.
That's all right, Steve. Glad to have you with us. So we have action items, and the first one, this would be a 5A, would be the approval of the minutes. So let's start maybe with a motion, and then I think there's an amendment or two.
I make a motion, we accept the minutes with changes.
Okay. We have a second on that?
I'll second that. This is Allison.
All right. So I know of one. I don't know if Debbie, you wanted to bring that up.
Sure, Tim. My name is actually Hartridge, and page 7, it's spelled Hartman. So that's another person entirely who I know.
Okay, so let's make that change, and that's pretty much a clear thing. Was there any other changes you need to make to this agenda? I mean, to the minutes from that meeting, blah.
Well, there was the Tracy Cooper.
Thank you. Does anybody know who, Joe, you wrote down Tracy Cooper, and we're not sure
Tim,
who she
I
is.
wasn't at the last meeting, Tim. I wasn't here.
Oh, that's right. Thank you, Joe. We had someone else. So if it's okay with, what do you want to do, board? You want to just scratch the name, or do you want to put a question on it, or what? What are your thoughts?
There is no member Tracy Cooper, so I think that was just a typo.
Thank you. All right, that will be a correction. Thank you, Laura, on the minutes. So those two corrections, are you ready to approve them with those two corrections? All in favor, raise your hand or say aye. All right, thank you. So ordered. So then the next thing on our action items is the election of officers, and I'm going to hand that over to the venerable Tim Ash to handle that for us.
Thank you, Chair Doty. So where we're at right now, we have a nominating committee who just recently, it's Tim and I have been working on it, but now that as we're getting a full complement of officers, there'll be a different nominating committee, but it gets convened every year to nominate and elect our officers. And 3 officers are the chair, the first vice chair, and the second vice chair. So what we typically do is we develop the nominating committee, talks to individuals to get an idea of their willingness to serve, and then we nominate people for those positions and present a slate. But that is just a nomination, and there's anyone that would like to nominate another individual that's not currently part of the slate, or if they'd like to nominate themselves, both of those options are there for you if you're interested. But anyway, with that, Tim Doty is nominated for chair. He's agreed to do an additional year if the board sees fit. And Laura Montagna has stepped up and is willing to serve as first vice chair, fill in for Tim if he's gone or goes to Wales or something. And then Alyssa Norman has agreed to serve as second vice chair. So that's the slate. And so I guess with that, I would ask if anyone would like to, at this point, nominate another individual or themselves.
Okay, I don't hear anyone. Then oftentimes in rules of order, a committee comes and presents them and it's considered the motion. If somebody else want to second that motion?
I think what we should do is do them one at a time.
Really, is that okay with the board? We want to do them in group, we want them one at a time. All right, let's break them apart. Who would like to vote Tim Doty as the chair? Raise your hand.
I will.
Okay, and then who would like to vote Laura Montagna as the first vice chair?
I will.
Okay, and then who would like to vote for Alyssa Norman to be our second vice chair? Raise your hand.
I will.
All right, Joe, it looks like all of them were elected. I was elected by a vote of 9-7. I want you to know that. You know.
And I just let the record show that although Alyssa Norman is not here today, she actually knows about this.
Okay. All right. Thank you. Thank you. So So those are the action items. I think I said at the beginning of the meeting, we do not have a presentation. And hopefully in the future, we will have that presentation. And I would say this also is our executive committee now has 2 new people on it, and it's made up of those 3 officers that we elected, as well as the past chair, which is Tim Ash. So there's 4 of us. And we primarily get together to talk about the agenda and the kind of things of how we operate and what we want to see the board doing. So then we'll move on to the next thing on our agenda item, and that is communications from the board members who have something they want to share information with us. And so I'd like to invite maybe Debbie, if you would share your communications with us.
Thank you. Thank you, Tim. I thought that the board would be interested in knowing that NAMI Humboldt is currently working on a project which would bring to Humboldt County an illustrious speaker, Dr. Thomas Insel, who has written a book that's pretty well known at this point in time called Healing. Let's see, here it is. Healing Our Path from Mental Illness to Mental Health. So that book has been reviewed recently in the New York Times, and I noticed it was mentioned in the Art magazine the other day, AARP. So anyhow, we are in contact with him, and he lives in the Bay Area, and he sounds to be interested in coming here sometime next year. And we're looking at probably springtime. And so I'm putting it out there. I think our goals with having a speaker like that, somebody who's well-known, who has a lot of experience, and he's written this book. He also was the director of National Institutes of Mental Health and worked on Governor Newsom's recent commission that was studying mental health throughout the state of California. So he's pretty well known. But the reason for having him here is to just create interest in the issues around mental illness, mental health, and work towards decreasing, I would say, decreasing stigma, and just in general, creating some energy, which we all need from time to time, a little boost. And he's a critic, but he also has, I think, an inspiring message about things that we're doing now, I think, in our system, but things we can do, perhaps other things, different things, the directions that we're moving. So we're talking to him about coming, and he seems interested in work. We've been dealing with the publisher and also with him directly, and we've decided we can afford it. We're putting some money into it. And if anybody's interested in input, or I'm telling you this to increase community support for the idea, please let me know, and you all have my email, and that's it for now. I think there'll be more information probably in the fall.
Thank you, Debbie. The local nominee board has a task force, I understand, just working on that. Is that correct?
That's correct, right.
Okay. Thank you very much. That sounds exciting, Mr. Ash.
Yeah, I just wanted to add that Dr. Insel was at National Institute of Mental Health for over a decade, but he came out to California. I don't remember, Debbie, maybe you do. It was like maybe 7 years ago, and started up. He wanted to work with technology and started up a company called MindStrong. I don't know how much involvement he has at this point, but anyway, I took a look at their website, and there's a lot more to it, but they're trying to meld typical clinical practice and an online, heavily technology influenced type of, I guess, practice or company. So I don't know much about it, but that's why he, came out to California.
And he now lives in the Bay Area.
Yeah. Thank you. Some other communications from the board, things you want to share with us?
How about questions they want to ask? Is this a good
Nope.
time?
This is a good time, Laura.
Oh, boy. All right, Paul. From your presentation to the Board of Soups, I had some questions. There's a joint conference committee that meets once a year. And when does that meet?
It's actually written that it meets at least once a year. It can be called when we have enough reports or information to that we want to present to our governing body. So that's a Brown Act meeting, and it's will be posted on off of our Semper Byron's site on the county site. But I believe we have one coming up at the end of June.
Okay, and was the last one last June?
No, the last one was 4 to 6 months ago. I don't remember the exact date. I can look that up if that's important to you. I think we have the information on that meeting posted on that website that I just referred.
Okay, thank you. I appreciate that. I usually just do a Google search, but if I can't find it, I know sometimes you got to dig down. So
Yeah.
I'll dig. And then the so the CSU's soft shutdown, how long can it be soft before it's permanent? And what does that mean licensing wise? Because
anytime we have a significant change like that in our service delivery, we notify Department of Healthcare Services. So we've notified them. We call it a soft open or soft closing because we're just not admitting right now because of our staffing shortages. So what that means is the CSU still has a designated staff that responds to crisis calls and
Paul, I'm
also does.
Paul, I'm going to jump
walk-ups.
in. Not everybody knows what CSU stands for. Okay.
Sorry, Crisis Stabilization Unit. It's our 4-bed, 24-hour crisis services.
Thank you.
okay. I think that-
Sorry, Laura,
that.
I interrupted. I didn't mean to, but
It's okay.
We're hoping to target mid-June for reopening. We've got several positions that we're trying to onboard now. So if we're able to maintain our staffing level and have an increase in our staffing, we'll be able to meet that target mid-June.
I don't know. And then the crisis residential treatment facility, there was the NIMBY issue. And so I know we sent a letter. And so I'm wondering where we are with that. Is there another site? That
is that something, Jack, you want to respond to? Or
Yeah, unless you wanted to, Emmy, or, yeah, okay, yeah, so we continue to look at different sites, and we meet with Willow Glen every other week, and they send up a representative to go on tours of specific places when we find them. We do have a couple of places we're looking at tomorrow, and one of them is pretty promising. So, you know, that's the update on that. We just haven't really found one yet that we felt really met, would be, you know, serviceable. So again, one though tomorrow looks pretty promising.
Okay, I just want to kind of stay in tune with what's going on. I was talking with some people at True North Organizing, and one of the things they do is deal with groups when there's a NIMBY issue and proactively engaging with communities in that way. And so, you know, like I reached out before, just trying to stay ahead of it instead of getting bumped out. So thank you for that.
so Laura, you have another question? I see Tim Ash and Ruth, but I want to give you the time, Laura. That's yours now.
Well, yeah, go ahead. we don't have a presentation. So I'm like, I got a list of things.
Okay, well, let's go on to others and then give you some time to come back. How's that sound, Laura?
That sounds fine. Thanks.
I see Tim and then Ruth. And, oh, Emmy, you wanted to jump in the middle of this?
What I wondered is if perhaps it would be helpful if I did my update, because some of what's being asked might be answered or addressed, and then maybe the questions could come after that.
I was thinking the same thing. This becomes a director's report and maybe not just a time. It's a quick question. So if everybody's okay with that, we can expand those questions when Emmy does her director's report. If that's all right. I want Ruth, I'm bouncing around to see. Did you have something else you wanted to say?
I can wait until after the report.
Okay, thank you. And Tim Ash, you ready to?
Yeah, this is pretty quick, but it's sort of statement and question. I heard recently that the state healthcare services was planning, or at least tentatively planning, to submit an application for an IMD waiver to the feds this fall. And I guess my question is for staff is if you guys have had any communications or through the mental health directors group, anybody that's talking about that, whether it's really likely to happen or not.
Can we kick that to Emmy's report?
No,
Sure.
Oh, I'm sorry, go ahead.
I'm going to ask Nancy if she has an update on that, but it can either happen now or whenever you guys would like.
Well, if it's a quick thing, Nancy, why don't you go ahead and take it now? I just want to interrupt with times for reports and our sharing, but we can do it now. Let's do it. Nancy?
Sure, Tim, my understanding is that the state has had conversations with CMS, with the Federal Centers for Medicaid Services, around an IMD waiver as part of the 1115 or CalAIM waiver. And that the response was something to the effect of invest in your system and then let's talk. So in response to that, the state put forth significant investments in last year's state budget towards infrastructure and towards building more beds. So I have not heard a timeline such as this fall. I think it will take some time for that money to kind of actually build places, at which point the federal CMS would have might look more favorably on an IMD waiver for the state of California.
Okay, so
that's as much as I know. I don't have a better update.
I'm going to jump in again. Not everybody knows what an IMD waiver is and what that rule is about 16 beds. Can you give us that quickly, Nancy?
Sure, either me or Tim Ash could do it. It's just, that's the law that limits us to 16 beds at Semper Virens.
Okay, thank you.
IMD stands for Institute of Mental Disease.
Thank you.
So
thank you.
Clearly defined.
Thank you. I see it, the hand up, and Isabella, you've been patient. Hi, Isabella.
Howdy, y'all. Okay. So I figured I'm going to lower my hand. I figure I'll use this also as a forum for me to take my advisory board hat off and put my social worker at the public defender's hat on to share some program updates on our end with regards to our critical services project, because that kind of seems appropriate and people are still 2 years in learning about myself and Dawnette and that we even exist. So I think it would be prudent for me to share a few updates regarding some inter-county collaboration. So I've got a nice, super cool PowerPoint presentation that is encompasses what our program offers and what the referral process is like. So I just wanted to extend an invite. If anyone was curious or wanted a copy of that, I can send that over. Or if anyone affiliated with any agencies would like me to come over or have a Zoom, help host, and would like to hear my very verbose presentation, I'm offering that to you as well. You have my contact information. And we're getting asked more and more about it. So it's a great way to network and also just put the word out in the community that we exist. So for example, I just did a presentation at probation, the adult probation department not too long ago, just so that everyone knows what is within our scope and what is exterior of our scope of work. So there's that part. And then I also want to share like I have a little binder that I've labeled progress that's like on all the great new things that we have done that are innovative and exciting. And one of those involves the behavioral health branch, specifically jail mental health. I'll provide a very brief background, but essentially what we're doing now are discharge planning. So between myself, jail mental health, and the Community Corrections Resource Center, once a month, or sometimes twice a month as needed, we meet over Zoom to discuss pending structured releases. So for people who are not involved in the criminal justice, sphere, structured releases basically entail the courts granting permission for a client in custody to be released, usually to a designee. And in my cases, it's to me specifically, or their assigned probation officer, or someone from a treatment facility. So myself and a representative from jail mental health and a representative from the Community Corrections Resource Center all get together and we talk about, who's on the agenda for the month. And in those meetings, we also, line up services, streamline services. So we get everyone has the dates, times of evaluations, mental health assessments, med support appointments. They're all on calendar. So we have the release done and we know exactly what's going to happen within the next 2 weeks and when it's going to happen and who's transporting who where. And, it's essentially like a wraparound kind of meeting. Back in my child welfare days, we called them child and family team meetings, so CFTs. So it's kind of like that similarly, but it's also something that has never been done before between our agencies. And I just wanted to commend everybody involved in it because, not only are we saving a lot of time and energy and resources, but this is really like the continuity of care and contributing to the client's overall health and well-being and making sure that, they're served to the best of our abilities. So I just want to commend everybody involved in that process because.
Thank you. That's great, Isabella. Communications from any other board members at this time? I see a hand up, Steve.
Yeah, thank you, Chair Doty. So Emmy may cover some of this, but a couple things. This probably won't be covered. At our board meeting on Tuesday, we had a public speaker who literally threatened gun violence against people for masking or other kinds of things. And it was not addressed by our board or the chair. It was allowed to occur. And then the person was even thanked for their comments afterwards, which is pretty shocking. Not just because of what's happened this past week, but just in general. We're still having some members of the community come forward and being pretty aggressive and speak quite violently towards people that are choosing to still mask, which is, it's our choices, right, that we're making. So anyway, that was disturbing. And I hope we do better as a board in responding to those kinds of things in the future. And I want to thank one of the members here today. I won't raise the name, but I want to thank that person for bringing this up to us at the board. Secondly, the other day, I spoke about our facilities master plan and how in an ideal world, we would create a DHHS complex on the parking lot across the street from the courthouse, where we would concentrate all of our DHHS services together and seek funding from the state with this $97 billion surplus to ultimately build a new SV hospital, state-of-the-art, modern, with a underground parking garage and really make better use of that parking lot, basically, with public health on it. It could just be a magnificent thing. And I was thinking, imagine if about 10 years ago, 15 years ago, St. Joseph's and the community had not done the capital campaign to rebuild St. Joe's and create the amazing facility that they have today. I know it seems overwhelming to think of creating such a complex, but right now we've got DHHS spread out all over Eureka, and that does not work well for the clients. You know, they got to get on 2 or 3 different buses half the time. It's not good for staff. It reduces communication and just makes it a lot harder to really work well as staff for the county as well as for our community. And I know it seems really, really daunting. And I know that Director Rogers and others are working hard to try and find money for the new lab, for instance, and other facilities. And it seems really daunting to think about this big thing. But if we had let that deter us with St. Joe's, heck, we'd probably still be working out of General Hospital today, right? That old 1950s building. So I just want to really encourage us as a community, and I as a board am going to continue to try and push this idea forward that in an ideal world, we would start planning for a complex where we bring all those things together with an improved Hope Center and all that different stuff. And again, this is not in any way to be derogatory towards staff, because I know that they all work really hard every day to try and make things happen. But I, as a board member, really want to keep pushing that concept forward. And guess what? If we get started now, maybe in 10 or 15 years, we'll have it. Nothing happens overnight. So anyway, I just wanted to share those 2 things with the board. Thank you.
Thank you very much, Steve. Before we go on, Joe, want to let you know that Madison has come to join us and put her name down as being present. Madison, glad to have you with us.
Thank you.
All right, now I also wanted to notice we have another member of the public, and that's Oscar. Glad to have you with us as well. Where we are on the agenda now is communications from the board members. And I didn't know if there was another one out there I want to invite. Hello?
No, I said thank you. I'm here.
Oh, okay. Glad to have you with us, Oscar. Look forward to talking with you again soon.
Yeah.
All right. Laura, I want to get back to you. Do you have anything else at this time you'd like to bring up?
I want to hear Emmy's report.
Okay, then we'll move on then. So the reports are the next item on the agenda, and we don't have one from Connie. And I'm going to stop assuming, Laurel, that you have something, for her to speak for her. So I don't mean to put that burden on you. Okay.
Thank you, Tim. We do check in with her if there's something she wants to relay. And so when she doesn't, she knows that Emmy and Emmy's team is covering the important parts. So
all right. I'll
taking me
thank
off
you.
the hook.
Okay, that's the whole idea, Laurel. So Emmy, you want to give us your reports?
Sure, and I hope I didn't overpromise, but absolutely questions can come after. I just thought as we were talking that a lot of the points were things that I had on my list. Before I start though, I really just want to acknowledge the tragedy in Texas. I just am feeling so impacted by that. And I think it's important for us to keep that kind of in the forefront of our minds. So let's see, I wanted to start by just thanking Paul for his presentation at the Board of Supervisors. It was a great presentation. It covered lots and lots of information, and I feel like it was an opportunity to just share information with Board of Supervisors and the community that doesn't always get to be shared. There were a couple points in that presentation. Oh, and Roberta Luskenhock, sorry, was there, which was great. She came and she spoke a little bit to the impact on the emergency departments. And it really was a nice opportunity, I think, for us to be together at at the same table, so to speak, and presenting and talking about these issues, which really we all have a piece in. I wanted to highlight some of the things that Paul mentioned, which I thought were really important, specifically some of the data around beds statewide and kind of research around what's really required. So here in Humboldt, I think it's 50 minimum. It would be required to support our community, and even a higher number than that recommended, perhaps 68. We don't have that many beds in our community. We have 16. And so just that's a real stark contrast when you think about what's needed and what we actually have here locally, and that's reflected throughout the state. I did want to just acknowledge that we have been doing a number of short-term specific things to kind of help with this issue immediately. And we are seeing really positive results. And so I want to acknowledge that and thank staff for that. We've really operationalized in-person evaluations for individuals on 5150s in really, really timely manners. And so we've been able to rescind and move people through very quickly. And we're really, I think, having some great conversation with the staff at the EDs. I check in pretty regularly with my contacts. I spoke this morning with Mad River about how things were going. I feel like they feel very comfortable reaching out if there are questions or issues, and then we can kind of problem solve together. With St. Joe's, we've been working to put in place some structure around more regular communication between our staff and their staff on specific cases, and doing kind of care plans, so that if we have frequent flyers that we're working together to think about how to intervene or support or direct those individuals so that they really can get their needs met. We're working very hard on 5150s and reviewing what's being written and finding ways to be able to be proactive and upstream in stabilizing people and getting them to the services that they need ahead of time, as opposed to being placed on a 5150. One of the other things that you all might have heard, I'll just acknowledge, is that the board did approve recommendation or offer to allocate some funding for St. Joe's. I've reached out to Roberta, and we're just kind of in communication around around whether or not that's something that will work for them to take on. It's about $200,000 annually for 3 years, whether or not that's something that will work for them to take on, to hire their own staff directly into the EDs to support individuals in mental health crisis. If they can hire staff, that's fantastic. As you all know, we've struggled with that. Although we've had some improvements recently. I just also wanted to say, there are things that are happening, and I feel like I don't always do the best job of reporting that out. And I was reminded of that while we were doing the presentation to Board of Supervisors. So for instance, I think there were questions around, well, couldn't we do better medical clearance for people in the jail? And actually, we've done a lot of work on that. And we have a mechanism in place so that people can get medically cleared without having to go through the EDs. And I think that's a success and really important, and something that we've done a good job with. We've also shifted to allowing antigen instead of just PCR tests, which is another, I think, way that we're supporting the community having easier and better access. And we're working on the medical clearance requirements with St. Joe's specifically around what is bottom line. We did get an EKG machine, and so that allows us to do some of the testing at our facility instead of having to send people over to the EDs for that. So there is a lot of really good work and progress being made, and impact happening, I think, for the EDs. The other thing I just want to say about the presentation that I really tried to continue to lift up, and I may be preaching to the choir here, but I'm going to say it anyway, is that it's so critical in my mind that we are consistently legitimizing mental health issues in the same way we do physical health issues. And so when we say somebody's in mental health crisis, or, needing support for mental health crisis or a psychiatric crisis, that's the same as a medical crisis. And so we need to be responsive to those individuals in the very same way. And even if we lack resources, because we do, it doesn't mean that they should be treated differently or talked about differently or, in any way marginalized because of the type of crisis that they're in, right? We still have responsibility to work together to strengthen resources and all do our part. But I feel so uncomfortable when I hear language sometimes around individuals who have mental illness and how stigmatizing and discriminating it can sound. So I just wanted to say that little soapbox thing. Thanks for listening. Kind of similar to that comment, the NIMBY issues, which I think you asked about, Laura, and we do have a couple of places we're looking at tomorrow. The Board of Supervisors has been very responsive and supportive to our requests around that. And in fact, when we were there on Tuesday, I think it was Supervisor Wilson who said, what is it? What can I do? Like, please just tell me. And so and that's right. That's the question. What are the concrete steps? And so I said to him, when we identify a building, then we'll be reaching out to the person whose district that's in and asking for really direct support. And so that's kind of the concrete things that we're doing. And we've gotten a lot of people kind of coming together on this issue, which I'm really grateful for. We have some Eureka City Council support and just others that are really saying, how can we help and trying to make a difference in moving this project forward. So 2 sites to look at tomorrow. We'll continue reporting out to this group. Hopefully one of them is fairly promising. So hopefully we'll have good news sooner rather than later. And the very last thing I wanted to say is just a thank you to HCTC for the digital stories. I don't know if any of you got to watch them, but man, fantastic, so fantastic. And I really appreciate it because they're frank, candid, sharing of their experiences, which I think all of us need to take to heart. And I have reached out to Sonia and to Kella, and I will be following up with them to just dig deeper into the experiences those young people have had with our systems, with CSU, with SV, with mental health, because I want to use that as an opportunity for us to learn and grow and to improve services and to strengthen and engage in relationships that are healthy and healing. So anyway, just wanted to say that as my ending point.
I was muted. Thank you. Thank you very much, Emmy. Time for some questions or comments. I see your hand up, Tim.
Yeah, 2 questions. One is, what is the source of the 200,000 per year that you're looking at possibly going to St. Joe's? And then the second one on the jail, I wanted to understand exactly what the limitation of any clearance at the jail is, because what I thought I heard Rex Bone saying was, take them to the jail for the clearance. And I was, a lot of people go to SV voluntarily, and they still have to get a medical clearance, but the jail's not involved and shouldn't be involved. I'm not sure if I'm really misunderstanding what he was saying or what you're saying is the what you are able to do at the jail.
Sure, I can answer both those questions. The funding is mental health block grant, and it's American Rescue Plan, the Urpa funding that is COVID related. And so it's a short-term funding, and it's specific. We requested it specifically to be supportive of people in mental health crisis in the EDs. We originally wrote it as something that we would provide through hiring staff, but it's something that we can now contract with the hospital if they're willing to provide. The clearance in the jail, my understanding, and I'm going to let Paul weigh into, is that really the request was around, if we have an inmate, somebody who's in the jail who needs to come to SV, can we get them medically cleared there instead of having to take them through the emergency department? And we have worked out, I think, a system in which we can do that, or we're improving, the opportunities to do it that way instead of the other.
Okay, I just, for what it's worth, I'm not sure that's what Rex was talking about. Maybe, I don't know.
Okay,
next time you talk to him.
Okay.
okay. Debbie, I see your hand up.
Yeah,
And
I
then
mean,
I see you, Ruth. Okay.
for St. Joe's and other ERs, is one of the needs to have more security, would you say? I mean, there have been some violent incidents apparently. Is that one of the possible expenditures of these funds, do you think?
Well, I don't know that's not what these funds are allocated for, although I do understand from Roberta, that is something that they internally are working on, increasing their security.
Okay.
Thank you, Debbie. I saw a hand with Ruth.
Yes, I was wondering if there is a video or recording of the SV presentation to the board, and where I would find it.
The PowerPoint, yeah, and it may have been sent out previously to you all, but it can definitely be sent out again.
Yeah, Joe, we're talking about Paul's report. Can you just send that out to everybody on our email list?
Sure.
Okay, thank
You
you.
know, Colleen, you
Thank you.
might benefit by taking a look at the recording of the actual board meeting itself, because it's got Dr. Luskin Hawk's presentation and comments as well. And I thought she was very clear and explaining what the issues were, and was very, level-headed, not pointing fingers, just saying, we've got a problem. I understand where it came from, and we need to try to solve it together.
And how can I access that, Tim?
On the county's website.
Okay, thank you.
Yeah,
There's a chat.
Laurel just put it in the chat for you as well.
Okay.
There's also like a summarized version if you prefer to read on Loco. They did a pretty extensive article about yesterday's meeting, just saying out there.
Thanks, Isabella. I just want to know, it helps me to know who's talking, because otherwise I'm scanning all over, to see who it is. But thanks, good thoughts, Isabella. Ruth?
No.
Oh, okay, you're okay. So any other questions or comments for Emmy from her report? Okay, then let's have another update on the AOT process. Jack, you want to tell us what's going on? Where are we on it?
Yeah, for sure. I think we are still definitely targeting July 1st for our start. Our contract for AOT is with County Council. We're hopeful that will be that review will be finished quickly, and that we'll be able to get that Medi-Cal org provider contract signed and ready to go by then. AOT, the EA organization that's going to be doing the AOT for us, we've been working on their education and training, the actual training that they're going to be doing, as well as the plan for that. And we're working on a list of people that we're going to be providing that training to, so that we can complete that education and training plan. So that's kind of where we're at.
So will there be some kind of a public announcement that says we're open for business? How do you kick that off and say we're ready to go?
Yeah, right. So yeah, we're working on the website right now. Currently, I forgot to mention that we're working on our own internal website. EA is working on their website. And so we're getting that sort of process down for how people will refer folks to EA. I imagine that we would also put, we would also go through our, sorry, my dog. We would also go through our channels here, DHHS, for announcing that, right? So through our Facebook and other social media posts.
Yeah, it seems to be a presentation from the county, because a lot of people, if they knew about it, would start wanting to plug in. And I just think sometimes as a county, we don't get that information out enough. And I know that's not on you, Jack, but this is a big deal and important, and I want as many possible people to know about it, okay? And I hope your dog is doing okay. So, so Tim Ash and then Katie.
Okay, I got it. Yeah, just a couple comments. Jack and I have talked about this, but I just wanted to kind of throw it out there again that it might be, it would be great if we could somehow put some kind of outreach to the NAMI community, you know, maybe with a Zoom meeting or something, so that at least you know, whatever else you do in terms of outreach, great, but for that kind of focus group of people that are, you know, potentially looking for referrals and trying to get, you know, loved ones into that kind of a program, it would be nice to do something that really targets those folks and make sure they understand how the whole thing works. And hopefully you're able to do that at the Board of Soups too, anything that's, you know, broadcast to the general public.
Thank you, Tim. We might even get that in the NAMI newsletter if I could only figure out who it is that actually puts the newsletter together. Hi, Debbie.
I have a comment too.
Oh, wait, I want to get with Katie Wilson next. Okay, Debbie?
Sure.
Dr. Wilson.
Thank you so much. Thank you. I just wanted to point out or mention to Jack in particular that I've been reading some about AOT and how it's done in different states because it's kind of a pet interest of mine. And I came upon something that you guys might want to have as well. It's a really cool resource. It's from Treatment Advocacy Center and at Texas NAMI, and it's 2022, their practice guidelines. And so I actually got a couple extra copies and I'm giving one to Daniel. I'm thinking his last name is Bixley. Do you know his last name, Jack? Do you know who I'm talking about? Daniel is one of the clinical program managers for the AOT that works for E&A Family Services. And anyway, I met him at a conference just recently and it was really, I think he's amazing. But this resource would be pretty useful, I think, to kind of not recreate the whole wheel. I know that the AOT team also already went to Nevada County to kind of find out how they're doing things. But anyway, I just thought it would, it's kind of a very modern, most updated practice guidelines. So if you guys want a copy, I can give you a copy as well.
Yeah, that'd be great. Thank you.
Thank you. Thank you, Katie. You have to introduce your dog to us next time.
It wasn't mine.
Oh, no. We all know whose dog it is.
Yeah, I only say that because I have two, but they happen to be sleeping at my feet. It sometimes is mine though.
Oh, okay.
I'll sign off. Thanks.
Okay, I love you, Jack. All right. That's the AOT report. You know, I keep thinking about this, but we can't do it. I don't think we said AOT means, and most of us begin to get it and we grab a hold of these things, but as much as we can, we need to let people know that assisted outpatient treatment. We can't tell everybody everything about it, but I want everybody to keep, you know, knowing about that. So then if out of AOT report, we go to the committees, and this is a time for any of our ad hocs or any of our other committees that they want to give us an update or share with us. This is the time we've kind of set aside on the agenda. Do we have any of our committees? I just want to say hello if you're recruiting people for your ad hoc or anything like that. No pressure. Debbie.
I just have a comment. I was noticing in recent minutes that there are a couple of ad hoc committees that I haven't heard follow up yet on. So I'm sure I'll be hearing, but one is on the NIMBY issue, and another is I think it's been hard to get people together for the legislative committee. So anyway, we're out there, some of us, and we're still interested. Okay.
That's a good point. Tim Ash and I have talked about an ad hoc committee when it's announced doesn't mean it's actually formed yet. And so, that doesn't mean they're not doing work. It's kind of like a working group, but you know, thank you, Debbie. We need to keep everybody else informed, particularly if you want someone else to join us.
The legislative committee, I can report that we have established the people that are on it, and Nancy graciously agreed to try to set up a meeting, but she's had trouble getting everybody to raise their hand for the same time, the same day. So we'll be doing that pretty soon, I hope.
All right, thanks. I know you've been busy. Well, we may be wrapping up this meeting a little early. As the chair, Laura.
I had another question, following up on the 988 mental health line that's supposed to be starting July 1st. Has anybody talked about that, or?
No, Emmy, who would be able to answer about where we are on that?
Paul, I know that Kelly and you have had some conversations about it. Could you share?
Sure. This is the national effort to take the pressures off of 911 for folks having a mental health crisis or emergency, or community members. So this is a nationwide effort, and California is rolling forward with it this summer. So the calls will go into regional call centers, and they will, the hope is to deploy local resources to the area, or to the individual or family that's in need of those services. So it's really an expansion of mobile response teams throughout California to try to intervene in upstream as early as possible. So there's still a lot of work that needs to be done at the state level. There's still a lot of conversation happening at the state level before this is implemented. So stay tuned.
Okay, but there is money that comes with it, so that's why I was excited. No? I'm paying for it.
Yeah, well.
Oh, come on, Paul, gotta say something.
No, I'm not prepared to talk about the finances of that rollout yet, but that's something definitely we can dig into later.
Okay. Okay. At the end, we had this thing about unfinished business or future business. And it seems to me that, Laura, we might want to pin that as an unfinished business so that we don't forget we want to do that. How does that sound to you, Laura?
Sure, I have a list.
Well,
Just like to follow up on things, because otherwise they're in my head and I can't get rid of them.
no, I don't want things stuck in your head, Laura, that's for sure. Not too many at one time.
I'm sorry, this is Sharon Wolf, and I just wanted to chime in with a possibly not helpful update on this one. Paul's absolutely right. It's going into effect. It's coming up really fast, and pretty much nobody has any idea what's going to happen, except that it's going to happen. It is going into effect. The state's figuring it out. As far as your fees, that's actually a big part of the fight going on in the state right now, is about the funding mechanism behind it. And thank God I don't have to understand funding mechanisms. But it is part of the fight on the funding for it. But I was just going to say, I saw an update yesterday federally, because it is a federal thing that's happening, and then all the states are implementing this. The latest update from the feds is that they plan to address this in some legislation after it has already gone into effect, is pretty much the timeline that they are looking at. So I wasn't overly surprised at that, but that's what's happening. It is going into effect. They are talking about resources, grants to states, the whole bit that we want them talking about. The timeline, however, they're talking about will be after the fact.
Better late than never.
That's right. Thank you. Thank you very much. That's very helpful. Debbie, and then Danette.
Since we have a little extra time here, I just thought it would be good to remind people about the fact that NAMI Humboldt is currently doing a family-to-family class. It's an 8-session class once a week. A couple people here are heavily involved with it, but it's people I meet later, years later, tell me that that class really helped them. And I just met somebody recently who told me that. So we do that. It's something we do. And if family members are out there that you happen to interact with, it's good to remind them to get in touch with us and get on our list for the next class. And also just a reminder that NAMI does, in conjunction with mental health, does offer weekly support groups for family members throughout the year. And those are ongoing, and also people who attend them feel that they're very helpful. So we have these things going on. Thank you all for those of you that make it happen.
Thank you, Debbie. I see Danette, and then I see a hand from Tim Ash. Danette.
Am I yelling?
No.
Okay. I just wanted to say, and I don't know really if it's the appropriate time, but I just want to let everybody know that we're having a Recovery Happens picnic and event on September 10th, and I would like to make sure that everybody is aware of it. And if you want to be helpful with planning it, we meet, the next meeting is on the 20th of June, and it's on Zoom at 5:15. So email me if you want to be a part of that. Thank you.
Okay, somebody's unmuted. All right, Danette, you can make that information available. Everybody knows how to reach you because you're on the board list, but also if you have something like formal, you can send it to Joe and we can send that out, but thank you. So Tim, you took your hand down.
Yeah, I'll wait until the chair, vice chair report.
Okay. All right, so then we're at that time, and I have kind of two things I wanted to share. One of them is I got some firsthand information about the return to competency program that our county does do in our jails. And I don't want to go into great detail, partly because I don't know all the details about how it's done. But I do want to say that I was really impressed with how well it worked for the person I knew who was there for like 3 months, and how they felt about being a part of it. Instead of sending someone who can't go to court because they're mentally not competent out of area, it happened here in our county. And it was, for that particular person, very successful and very effective. And I just want to let people know that that was a great deal. So the other thing is a little bit on the line of what Steve was bringing up. There's so much, and wanting to get Insol to come and speak. I don't know how we as a board or as a community can step back and do larger range strategy thinking. Where do we want to be in 10 years, 15 years in our mental health services? Because we deal with crisis after crisis, day by day, and we're scrambling, and everybody on staff knows that you're grabbing for a little bit of money here or there, hire this person, see how you can do that. So I think that, and I do not like to get into strategic planning meetings because sometimes they go for 6 months and nobody ever knows what you do, and then you forget about it the month later. Having said that, I would like us to think about what does it mean as a county if we strategize out and look at a bigger picture. What do we want our services to be like? That's where my mind is going, and I just wanted to share, put that out. That's enough from me right now. I see Tim Ash, and then I see you, Katie.
Jack, did you want to say something? Okay, it looked like you were. Yeah, I just have a couple things. One is on the NIMBY issue. I just wanted to offer up. I've worked on NIMBY issues before in my working life, and got some training on that. And there's ways to do it that are kind of strategic. If anybody is interested, the short of it is you take a look at all your options and analyze them, pros and cons for the community and the neighborhoods, and then you make your decision based on a fair and rational balancing of all the factors, and then you present that to the people and say, this is, all we looked at to come to this conclusion. And people tend to take it a lot better when they feel like they're heard and they understand that it was looked at fairly. And maybe in this case, they got the short end of the stick, but they tend to take it a lot better than if it's just kind of percentage fait accompli. And anyway, but I just wanted to say that. The other thing is that that Tracy Connor. Tim, I think alluded to this earlier, but we had heard that she was leaving the board. We haven't heard from her. I called her and left her a message and explained that the process was she should write a letter of resignation to the Board of Supervisors and copy the chair. And I haven't heard back, and apparently that hasn't happened. At this point, she's missed enough meetings. If she doesn't, not interested in doing that, that's fine. I think we should pass that along. If I'm correct in her attendance, just pass that along to the Board of Supervisors and say that's another vacancy.
Well, I
So-
kind of wanted to have a double check with her again. And Laura, you've talked with, did you want to say anything, Laura, about Tracy, or?
Yeah, regarding that, I spoke with some nurses or people. I was at the St. Bernard's Job Fair and talked with them a little bit about that. And they said, oh my goodness, we have someone who we'd like to nominate for that. So like to take that similar position. So I don't know if that's something that's appropriate. I just wanted to let you know. I will be bringing that person.
Okay, thank you.
They
Yeah,
should
let's
just
Go
apply.
ahead.
They
Yeah,
they
Jeff.
should just apply, send a letter to Joe with an application. The last thing I wanted to mention was just kind of follow up, Tim, on what you were saying about Steve's comments about we need to think ahead, and if we want to be somewhere in 10 years, we need to start at a time that'll get us there in 10 years. And then to the entire system thing, I brought this up at one of the sequential intercept model meetings a couple of years ago, but I would, and maybe this exists and staff stop me if it does, but I would like to have us take a look at the community and assess our facility needs in particular, not just county facilities, but just how many crisis residential beds. We have some statistics, recommendations for 50 beds for 100,000 people, that kind of thing. But that may not exist for some of the other types of facilities, step down boarding cares. But it seems to me that we have an idea of numbers of people in the community that need in the past. And I'd like to see us coming up with a picture of what the community facilities, what needs to be in place and built, so that we know we may not be there now. We may have, it may be a while before we can, but at least we would know what we should be trying to do. And I'd like to see that. It's not a behavioral health board thing, although we could help, but I think it would be really important to have that community. And then if at some point we may decide, I personally have an issue with leasing all these buildings. It causes issues. I'd like to see more that we own. Some of them we never would. But anyway, we could maybe look at bonds, look at what the options are, look at grants, and we'd have a goal, something to shoot for.
Thank you, Tim. I see your hand, Laura, but Katie's been patient, so.
Oh my goodness, that's funny because I'm not usually known for my patience, but so thank you. First, I want to just commend both of the Tims, and then also I'm really so thankful to Supervisor Madrone, both for being here today and then also for your involvement. I did watch the morning session of the meeting, so unfortunately I have no idea the second thing you were mentioning, but I'm going to look into that. But in any case, I am so delighted to hear how much energy there is towards like planning for the near future and then farther future. I think that that's just amazing and fantastic. I would sure be hoping that the state is going to end up ponying up for some of these projects because they do have this big budget surplus and they are, talking a lot about how much they care about, community mental health treatment. And then Tim Doty, when you were saying something about like sort of planning, I think, and Tim Ash, actually, you were saying about kind of assessing where we're at now. I noticed at the supervisors meeting on Tuesday that Roberta, Dr. Luskin-Hawk requested that somehow a group, I don't know if it would be DHHS or maybe a combined agency group, would do a boots on the ground, like analysis of what the current gaps are in services, like immediately. So I think there's all this great stuff going for the future. And I think that's really exciting and uplifting. But I think, it's clear that there's current gaps. And, I think Dr. Luskin-Hosk was trying to encourage us to try to figure out where are some stop gaps in the current continuum of care. And so
Great.
anyway, I hope that maybe that will be a sort of a spin-off of that Board of Supervisors meeting, so that in 3 months when they revisit the issue, maybe there could already be, some data on specific gaps. And I would throw out that there was a letter that was written about a patient who, it wasn't me that wrote the letter, by the way, it was a board member. And I'm not remembering the details, but what I do remember is that it was a perfect example of the perfect storm that this patient encountered, and at multiple levels of the continuum of care. And so, that would be a perfect example if the committee or whoever's going to be looking at it could look at some specific patients' experiences of where the gaps have been. Okay, I'll be quiet now, but thank you.
Thanks, Katie. Did I see another hand coming from you, Laura?
Yes. This is for Emmy because I remember you were there in 2018. There was a giant 2-day thing at HCOE, and all the agencies were there, Crossroads, everybody was there. Everybody had their problems, what we need to do. And I thought HMA, I think, Dr. Corey Waller, and I thought we were supposed to get this big plan. That was in 2018. Whatever happened with that? I sent an email to Dr. Waller. I never heard back several times. What happened with that?
That was facilitated by HMA, and also I think the IPA was involved. Is that right? And it was SUD specific, substance use disorder specific. So it wasn't just for the broad continuum of care. It was related to SUD and how do we ensure appropriate continuum of services. SUD is a little different in our county now because we
Okay, the acronyms are using acronyms a lot. Help us.
Substance use disorder. Yeah. We did opt into the drug Medi-Cal organized delivery system. And so we actually provide those services in our county for our consumers through a contract with Beacon. I mean, we have a piece of it, but Beacon's the holder of that contract and those services. I mean, not Beacon, sorry, Partnership Health. But you're right. I actually inquired to that recently as well, Laura, because we were talking about some transitions around substance use disorder treatment. And I said, where do we remember we did this mapping? And so I'm not the holder of that information, but I think you're right. That would be helpful information for us to have, at least in the area of SUD.
Yeah, there was a final report on that too that they issued. And there was some follow-up work too around community-wide, everybody using the same screening tool and the same assessment tool and some process. And the IPA was really instrumental in that part of the work. So it might be good to look back at that final report and review that. It was really a great event. You're right. I mean, that was the first time I think we've gotten over 100 different providers together in the same room.
It was
talking about
amazing.
this issue.
Yeah, and everybody was so engaged. So do you think I should reach out to IPA? Would they have that?
This is Nancy. We're part of the coalition. It's the RX Safe Humboldt. And I will, let me get the email and I'll put it in the chat. Does that sound good, Laura?
Thank you, appreciate it.
IPA, what does IPA stand for?
Independent Physicians Association?
Thank you.
Independent Practice Association. They're just kind of one of the conveners for the RX Safe Humboldt Coalition, which is really began around opioids, but is really much broader than that, around substance use disorder.
Okay, thank you. I'm just
We are, of
want
course,
to
the
raise
partner
those.
in that.
Thank you very much. Well, where are we? Did I see another hand? I see a hand from Debbie.
Yeah, I'm working on this League of Women Voters study about mental health issues, and this mention of Beacon reminds me that Beacon came up, has been coming up, and we're not all that clear about the role that Beacon plays, and this may not be the time to elucidate that, but maybe sometime. Beacon's an insurer, but yeah, anyway, if I'm not sure how an individual patient interacts with Beacon, or how the county interacts with Beacon, or what role they play.
Emmy, got a quick answer?
I can just say very quickly, and it might be worth a broader discussion, but so Partnership Health is the managed care plan locally. Beacon is who they've designated to handle the mental health portion, outpatient treatment. And so we, the county, provide services to the highest level needs. So we call that level 1. There's level 1, level 2, level 3. And in the adult world, that's those with severe mental illness. And those that don't meet that highest level criteria then get referred to Beacon and connected with community providers that they have contracts with.
Thank you. That is what I thought, but there's been some confusion about whether the county is contracting with Beacon, but no, it's not. You're referring certain people to Beacon. Okay. And the difficulty that's come up is that there's a difficulty finding providers apparently through Beacon.
Yes.
Not necessarily Beacon's fault, but okay, great. That helps.
Thank you, Debbie. This time frame on the agenda is kind of moved into a catch-all. This was the time for different committees, and that's fine with me because we need these times, but I just wanted to comment that on the agenda. So when it comes to future items or unfinished business, to ask the board or things that you want to make sure we take a look at next time, we don't forget about them. I keep seeing your smiling face, Nancy, and I want you to know it's a nice picture of you. All right, I think we've covered everything. We're actually can close this meeting early. I want to thank everybody. Last chance to say something brilliant and wise. And all right, everybody, goodbye. Thanks. We'll see you our next meeting.
Everybody, thank you.
Okay, bye-bye.